Good evening and welcome back. Every year, 39.5 million people die from NCDs. You might be surprised to know that between 250 to 400 million dollars is what costs the Fijian economy annually, with heart disease, diabetes, and cancer topping the list of NCD cases each year. Joining me this evening to talk more about this is Ms. Pramila Kumar, Chief Executive Officer of the Consumer Council of Fiji, Mr. Ferdinand Strobel of the Health and Development Specialist for UNDP Pacific, and Dr. Pablo, Chief Community Officer, Health Officer with the Ministry of Health. Good evening and thank you for joining me. Now, 200 to 400 million dollars. That's a lot of money, yeah? Yeah, of course it is. You know, non-communicable diseases was once known as a rich man's disease. My grandfather lived up to 90 or 93. And one thing I've noticed was, could this be associated with economic development? Would you say it's associated with economic development? I remember a statement made by Dr. Tukana sometime this month saying that non-communicable diseases didn't start until 1985. And I know that the Consumer Council of Fiji is working hand in hand with the Wellness Center and with the Ministry of Health. Now, what I'd like to know from you, Pramila, is what exactly is the Consumer Council of Fiji's involvement in the fight of NCDs, in the fight against NCDs, rather?
Consumer Council of Fiji is definitely involved with combating NCD. And the reason being, we strongly believe that consumers and consumer choices are central to NCD containment. And for that, we have to do more awareness raising with consumers in terms of how they can make healthy choices. And at the same time, they can take their health seriously. Often we hear that consumers should be responsible, and generally the messages that is being passed on by various stakeholders, whether you call it a doctor or health specialist, or even from the private sector, and for that matter, even from the government, that consumers have to take their health seriously and they got to be more responsible. I agree with that to some extent, but not overall. Because as you have talked about development, economic development has taken place over the years, and we have seen that consumers are facing more difficulty in making the right choices because our food environment has changed. We see more processed food than other types of food that people are consuming. And again, there are many reasons as to why consumers are opting for processed food rather than fresh or organic or from the marketplace,
and has the Consumer Council of Fiji done a lot of research when it comes to consumer preferences in what type of products that they buy?
Absolutely. If you look at the shopping basket, you'll always find a lot more processed food than what was consumed, say, when your grandfather was there or in his time. So things have changed over the years. And the only reason why you see a change in consumer behavior is because consumers in this day and age, they look at the cost, affordability of the product, availability, and convenience.
With the Ministry of Health, I understand that there is a workshop that is currently underway that started last month, I'm pretty sure. With the Ministry of Health, I'm pretty sure that there's a workshop that started a couple of months back. That had to do with both the Consumer Council of Fiji and the Ministry of Health working together. And it's called the Alliance for Living, the Alliance of Healthy Living. Now, tell me more about that. Where do you go? To which parts of the country?
Usually we go in the different communities, in the central, in the western, the northern, the eastern divisions. Actually, what we really want to for the consumer is to empower them of the knowledge and the skills that they have. Even in the health system, or when a patient comes to us, the doctor will advise them, you take this 5 servings of fruits and vegetables every day, or you exercise 30 minutes a day. But You know, these people, it all depends on them whether they're actually doing this or doing that. So what we in the Ministry of Health, our role is actually to empower them with the knowledge and skills to fully understand what actually is what they can do to to about their health, to improve their health as well as to protect themselves from having these NCDs.
It's funny that you say that. We grew up knowing that we're supposed to eat healthy. We learn it in schools, high schools. We're supposed to eat a well-balanced diet. We're supposed to have a lot of fruits and vegetables. Why is it, and this question is posed to all of you, why is it do you think that we're unable to follow a healthy diet? You know, every once in a while, I mean, I gotta say, I find myself picking, I indulge every now and then. Soft drinks, chocolates, but why do you think we cannot keep it consistent?
You raised an interesting point earlier when you said RNCDs related to economic development, and they used to be considered disease of the rich and disease of the rich world. Now, if you look at the global picture, the relationship is actually the opposite. They have become disease of the poor. Even in rich countries, it's the poorest people that are the most impacted. Why? Because people consume what they can afford. And unhealthy products have displaced healthier options because they're much cheaper and hyper-processed. And that's what we are seeing in most of the developing world nowadays. So let's go back to the fundamentals. These diseases, what are they? They're diabetes, they are heart and cardiovascular disease, heart attack and stroke. They are chronic respiratory diseases, and they are cancers. They stem from 4 key risk factors. One is the poor diet, so a diet too rich in fat and sugar and salt, not enough fruit and vegetables. Second one is lack of physical activity, and then we have tobacco, which is a major problem, tobacco use, and then we have alcohol abuse. So that's what happened. People are consuming more unhealthy diet, are being less physically active, are consuming more tobacco and more alcohol. That's why we have this problem.
Let's just put a pin in that. We'll definitely come back to that. We'll be back right after the break. Welcome back to For the Record. So, Mr. Ferdinand, you were talking more about on development and how, now it's known as the poor man's disease, given that a lot of poor people are buying what's affordable. And what's affordable nowadays is not healthy for them. High in sugar, high in salt, as you said. But can't they do something about their lifestyle by planting or going fishing like they used to do before? What's hindering that right now?
The population also is becoming increasingly urbanized, and it's often not a very well planned urbanization, where you see cities that are developing now are in the developing world, centered around building more cars and roads. And while if you look at the opposite, if you look in the developed world right now, they're emptying their cities from car and building walkways and cycle lanes to get people more active. So it's not just urbanization by itself, it's how do you actually conceive urbanizations. People are no more living in villages, or less and less living in villages. They're buying their food from the supermarket. Now the question is, what's available to low-income earners in the supermarket? Very little. I don't know. If you take somebody who makes 20 or 25 Fiji dollar in a day and they have to feed 5 people, what can you really afford? Can you really afford vegetables and fresh fish? No. So it's also fundamentally an economic problem.
Dr. Pablo, in this particular case, when it comes to eating healthy, why can't the people who have some form of NCD or living with NCDs, why can't they do the same? What hinders that recovery process?
There are a lot of factors in that. It's not about medicine that we give. It's not about the one we do at the healthcare facilities. It's more on the socio-cultural aspects or the social determinants that actually make the people to have the right choices. So we tell them to eat this and to eat that, but as what Ferdinand has mentioned, is is there a supportive environment for them to make the things cheaper, or the fruits and vegetables cheaper in the market, or make the footpaths more accessible to the community? Although the footpaths are there, but is it safe for the people to walk, and especially at night, is there a good lighting? Or is it disabled friendly for people with disabilities, especially these people who have NCDs? They have some forms of disability. So thus, is there a supportive structure that is in place for them to be able to perform these activities, physical activities?
So in terms of diet, would families have, I mean, obviously, that families would have to play a key role in that. It's in the recovery process, whoever's going through, let's say, something like diabetes. So
yeah, you're right.
What's one of the things that you can identify, one of the problems faced by someone trying to recover, especially concerning family?
Now, when we see a patient in the clinic, we ask them, why your blood sugar is not going down? Why your blood sugar is still high? We've been telling you eat this, eat that, but when we go home, we depend on our family. It's our family who cook food. It's our family who buy the food. And us, the patients, what the patient usually tells us is that we only depend on what being put in the table, what the family can afford.
So they have absolutely no control of whatever is for dinner, for lunch.
You're right.
So it depends on who's earning what and what kind of food they're bringing into the house.
Yeah.
Now, Pramila, I understand, and this is something I've read in the media, of course. Help me understand the sweetened beverages taxes.
Okay. I think I would like to go further talking about the Alliance for Healthy Living.
Okay, sure, and then we can come back to that.
Yes, because sugar-sweetened beverages is linked to Alliance for Healthy Living. Alliance of Healthy Living was created by a core group, which is Consumer Council of Fiji, Diabetes Fiji, and Food and Nutrition Center. So these were the three main organizations that created Alliance for Healthy Living. And the reason for this was to engage more with the community and how we can use community to push policy changes. Because at the end of the day, the community is affected. And how can they have a say when it comes to policy reforms or policy changes? So the main aim of Alliance for Healthy Living, which was created in 2014, was purely to deal with sugar-sweetened beverages. And why sugar-sweetened beverages? Sometimes we are posed this question that why have you picked sugar-sweetened beverages and not something else? It was a decision made based on the advertisement monitoring that was done. And when the advertisement monitoring on the media platforms were done, it was found that about 89% of the advertisements were mainly on food items that had very little nutrition value.
And high in sugar content.
Yeah, and about 71% of those advertisements were linked to sugar-sweetened beverages. It was basically soft drink advertisements. So we felt that this is a very common item that consumers generally pick, although water is readily available, but they end up buying soft drinks. So we decided to have a number of workshops, which we did, and it was out of this workshop that the decision was made that we should lobby with the government to increase taxes on sugar-sweetened beverages. Because till 2012, there was just 5% duty on sugar-sweetened beverages. So in 2014, we made a budget submission, and all the members of Alliance for Healthy Living, they also made a similar submission to the government. And I must say that the government considered the submission, and from 2014, we have seen an increase in the taxes for the sugar-sweetened beverages. And from 2014 till 2017, and now we have seen an increase of about 30 cents on sugar-sweetened beverages. Now, one might question whether increasing the taxes is really discouraging people from consuming sugar-sweetened beverages. And my response to that would be that that was not the key intention. It's really left to the consumer choices. But the idea of putting that taxes was actually to use that money for awareness raising, so that we can go out to the community and literally teach them how to read labels and how to plan their meals and how to take care of some of the diseases that they are suffering with. So from the clinical, preventative, and other socioeconomic factors to be considered in totality when we reach out to the community, so that they have a better understanding.
There's definitely something I want to touch on shortly after this. You're watching For the Record. We'll be back shortly after the break. Welcome back to For the Record. All right, so Pramila, you told me that 71% was soft drinks. Now, how effective has the alliance been since 2014? And my other question to that is, what has been done with awareness? I mean, if it's 71%,
The
yeah,
advertisements.
how effective has the awareness been on your part with the Consumer Council?
In terms of the effectiveness of Alliance for Healthy Living as an core group, I would say that we don't have any particular budget to work with. It is purely left to the organization to raise their funds and to do community awareness program. So in terms of effectiveness, I would say we were effective in the sense that the reason as to why Alliance for Healthy Living was formed was to really put sugar-sweetened beverages on government's agenda and to ensure that the taxes go up, which we succeeded. So that was the first tick in terms of success. Second one was to do with the management part of diabetes. We looked at the glucometers and the strips that are sold in the market, in the pharmacies. And we found that the obsolete types of glucometers and strips were being sold in the marketplace. And when consumers buy this,
They don't get a proper reading.
actually they were not able to buy the strips after 1 year because the meter was obsolete.
Oh,
And when they went back to the pharmacy, they said, oh, these strips are no longer available. So obviously, it's not an incentive for a consumer to spend on glucometers. So we made a submission to the government, and they have removed the duty to zero on glucometers and strips to assist consumers in managing their diabetes. So again, that's a positive result. And we are working on the third submission through Alliance for Healthy Living, which is more to do with the food. As you know, 80% is food and 20% is exercise. So when we look at the food component, and it's very, I would say, very visible in Fiji, that when you see people dishing out food, they'll have more carbohydrates, less proteins and other food groups. So bulk of the plate is filled up with rice, dalo, roti, one of those high energy dense food. So we would like to work on carbohydrates now and see how we can get the duty reduced on healthy carbohydrates and get higher duty on unhealthy
how about with
carbohydrates.
certain foods that are very, how can I put it, that are the go-to kind of foods for people, low-income earners? I'm talking about foods that are high in salt content, high in sugar content. Are you also trying to lobby to get...
Oh yes, I'm working very closely with Ministry of Health as well as I said, with other stakeholders, because as I said, consumers are central
yeah.
and the choices are very important in dealing with NCD. So our input is always there supporting this organization. And for the low-income earners, food is an issue. Whatever money they have, first thing they will buy is carbohydrates. That means rice, sugar, flour, and they will not buy a flour which, sharp or other type of flour which has got a lot of fiber. They'll end up buying just flour.
The cheapest.
Yeah.
The cheapest, because it's cheap.
This is something similar that the patients that you have counseled, obviously, have come through the services.
Yeah.
Is this one of the things that they've mentioned as well?
Yeah. Usually we don't provide them with glucometers. For example, as what Pramila has mentioned, we only provide those to children who has diabetes. But for those who are adults with diabetes, we don't usually give glucometers and strips. You know, that's true what Pramila has mentioned. The glucometers are usually cheap, but usually the strips are very expensive. And as what Pramila has mentioned really is, well, it's true, wherein they change, wherein what your glucometer this year would be obsolete the following year. So they change a lot. So one of the factors are actually we have some like some food regulations that are in place, but actually it's we compete more on the manufacturers who have more of social marketing to the people, to the consumers. So actually we compete with them with regards to the choice of the consumers.
That's quite interesting what you said with food regulations. Is there such a thing happening right now within the economy, or that the government is working alongside with the Consumer Council of Fiji in terms of behavioral change? Like trying to get the consumers to shop smarter?
In terms of what government is doing, and I think this is where the credit is due, you've seen recently that more footpaths are being made.
Yeah.
That's good. At least people can walk on the footpath, you know, as part of the exercise. And we've seen, at least in Suva municipality, there are some exercise machines being placed in the parks, etc. But that's only for Suva. What about in other areas like Nakasi or in the Western Division? I think there has to be more emphasis on providing such devices and providing such equipment in public places, so that public can do the exercise without having to think twice of paying a sub to the gym or thinking what else can they do. So we are the government has made, or they're trying to make, or by providing facilities where public can easily access and continue with the exercise.
Now, with Ferdinand being with the UNDP, addressing NCDs requires significant action beyond health sector, especially to address root social and environmental and political factors as well, which contribute to how things shape NCD burdens. Now, do you have any stats or impacts of NCDs on our economy from the last 10 years?
Well, we at UNDP, we are a development agency of the UN, so we look at NCD not from the medical side, but more from the economic and social development side. And if you look at NCDs, they impact the entire society at all different levels. Individuals are impacted because they die too soon, and they live a long, sometimes a low quality of life with disability. Households are impacted. They lose breadwinners. They lose loved ones, carers. People have to forgo some opportunities to look after their sick parents, and it's often girls and women who do that work, and it's unpaid care work. You have to look at workplaces. They lose workers. They lose productivity from people not being able to work fully at their full potential. You look at the health system. It's completely overburdened. The bill is growing every year. And then, so the economy entirely is impacted. So
That's definitely
all kinds of impact at all different levels. For the cost, that's different.
Yeah.
We did look at the cost.
I want to touch on that shortly after this, but we'll be back right after the break. You're watching For the Record. Welcome back to For the Record. So as you were saying, Ferdinand, all to do with, it ripples down. It ripples down. Now, can you, funding for NCDs, how much has been given for projects with cancer, diabetes, chronic cardiovascular disease? Does the UN give funding for stuff like that?
UN is not a donor. UN is a provider of technical assistance.
So only
the lead agency for technical assistance for the health part of the response of NCD is the WHO, the World Health Organization. But all other UN agencies also contribute. So we contribute in terms of policy, in terms of linking, for example, UNDP. We're trying to engage more the non-health sector, analyze NCD as a development issue, look at sometimes the cost implication, try to make a socio-economic case. So NCDs is answered not as just a public health issue, but as a development issue, just like we do for climate change, for example.
And
so the funding, you still want some for the funding?
Not about the funding. What I want to talk about is on the stats in the country.
Yeah.
With concern to the amount of money allocated in the annual budget for health, how much is used for NCDs? Exactly
Okay.
how much?
So I'm not the best person to talk about the budget and the health financing in the country, but I can just tell you that through that costing analysis study that we looked at both the direct cost, that's the cost of healthcare, if you like, and the indirect cost, which is more on the cost of the economy. If you look at just the direct cost for diseases, so diabetes, cardiovascular diseases, cancer, and chronic respiratory disease, just 4 diseases, they just 4 cost 25% of the health expenditure of the entire country. So it's significant. It's a huge burden on the healthcare system, financially and also in terms of workforce. Hospital beds are filled with patients with NCDs. I think there's an amputation every 8 hours because
Which is
of
a scary thought.
because of diabetes. So, I mean, the health system colleagues can tell you more about these details. What we also see is that the health expenditure are increasing constantly and significantly. That's not just because of non-communicable disease, but as I told you, since they represent a big share of it, they play a major role in that.
With the Ministry of Health, what are some of the weaknesses that you can identify as well? Or some areas that need to be improved, maybe facilities?
Yeah, with every health system, I think it's not about the human resource or the staffing, although we have some issues with some challenge with the staffing, but it's also, the health system also includes the infrastructure, the health facilities, whether the health facilities are accessible to the people, at the grassroots levels. As what Ferdinand has mentioned, financing, that's part of the health system, the financing and the funding of the health system, as well as the appropriate technology, the health information. These are actually what comprises the health system. So in a resource-limited setting like Fiji, the NCD is quite really a burden to us that the health system can actually cater on or can afford, or it really poses a great challenge to the health system. And what we really to improve this, what the Ministry of Health is actually doing is just to empower the community to look after themselves. If people are healthy, if people only look after themselves, there will be less people that will overcrowd our health system, our health facility. So aside from making our health services accessible to the people, actually our staff, our healthcare workers, especially our nurses, they go out to the community. We regularly conduct community outreach programs to not only to create awareness, but also to deliver service to the community, to do some screening, especially NCD screening, to detect while it's still at the early stage so as to prevent complications. Now, when we detect NCDs at an early stage, we'll be able to prevent further complications as well as prevent further impact not only to the person themselves but also to the burden to the health system as well. It's not only that, we're also doing a lot of awareness especially in Suva, we have the workplace promotion program wherein we go around the workplaces. We want workplaces.
That's very interesting that you mentioned workplace. Do you think here in Fiji that we create an inclusive environment when it comes to combating NCDs, like in the offices, like you mentioned? That's something that you guys do. What about in our homes or other workplaces?
I think there is a problem here.
Yeah.
while we are trying to change the workplaces, it's very difficult. The evidence itself is when you look at the obesity, how big the staff are, and the consumption. You'll see that every tea time it's white bread and tea.
And usually 4 spoons of sugar.
Or even more than that.
Yeah.
Yeah. And lunch is again probably a tin of tuna and bread. And this is all white loaf. So there has to be a lot more that needs to be done. And that reflects on the household. As a family, what kind of planning is being done about the meals? Are the meals planned? Do we work out what we'll be having for dinner, lunch, and breakfast every day from Monday to, say, Sunday? And based on that, do we do our shopping? In fact, it's not happening. What we normally do is we go home tired and we say, okay, what can we have? We look at the most easiest food. And the easiest is what is available in the supermarket. So you just buy processed food and you end up eating that. So that needs to be changed.
That's something I definitely want to continue talking about. Well, we'll be back shortly after this break. You're watching For the Record. Welcome back to For the Record. Now, Pramila, you spoke about meal planning. I have a question for you, and this is mainly to do with the research that you've done with Pennature. Now, clearly, people are buying cheaper.
Oh, absolutely. People are buying cheaper products based on what they can afford, what they are earning. And we have seen that the most unhealthy food are the cheapest as compared to healthy food. For example, palm oil as compared to, say, canola or even olive oil. I mean, olive oil is out of the picture. It's so expensive. Or taking flour against, say, chakiata or flour that has got more fibers. And the easiest one is comparing a soft drink with bottled water. So you can see there is a huge difference.
Very
and normally
huge
we
difference.
hear that people should go to the market. And something that opened up my eyes was recently when the issue was raised at one of the community workshop, where they were talking about the cost of our produce in the market.
It's gone expensive.
It has gone expensive, and unfortunately the prices have not really come down as we expected after Cyclone Winston.
And
It
is this
has come
something
down.
the Consumer Council of Fiji plans to try and probably rectify?
It's impossible because some of these items are not under price control, and the only option consumers have is to at least plant some fruit trees at home.
So encouraging everyone to find solutions by
Yes.
taking the initiative, start planting at home.
Yeah.
Are there any other solutions that you'd want to add on that could help in the combat against NCDs?
Well, we had Dr. Pablo talking about the healthcare system response, but like we've discussed around the table, we really see that the solution is way beyond the reach of the healthcare system, and it's about building environments that are more friendly, conducive for health, whether it's the food environment or it's the physical activity environment. We need both. We need top-down approaches like taxes that create disincentives for people to make. I mean, the end is to make the healthier choice the easier, and the unhealthy choice the
More
bad
difficult.
choice or the costly choice. And then they work. Look at tobacco control. It's working. It's deterring people from smoking, generates a lot of revenue. That revenue can be reinvested in other social goods. So top-down is needed, but we also need bottom-up. We need community mobilization. We need consumer movements. We need social movements to sort of revisit what we consume, how we treat our body, and how we treat our planets.
So basically, everyone just working.
It's everyone's business,
Yeah.
and it's too easy to say it's the healthcare system's business. It's a whole society that needs to take this issue at heart and work on it, from individual to family to every sector of the economy or the country.
Which might be, Dr. Pablo, I know that the Ministry of Health faces a lot of blame, people saying that you're supposed to cure me, and but a lot of times it has to come from their part. Well, 50% of it has to come from them. You know, wanting to be cured, wanting to get better, which means they have to follow the proper treatment. What is a solution or method that, or message that you'd like to give people living with NCDs?
Yeah, this is actually the message that we give to the people. You know, it's my life, it's my health, it's my responsibility. So it's actually, this is my health. I need to be empowered more. I want to know more what really causes sickness, what causes the NCDs. So when I fully understand what's really causing me to develop NCDs, then I'll be able to take actions, as well as it's not only about myself that can do this. I need support. I need support from my family. I need support from other members of the community. I need support from the government in terms of having a supportive system, enforcing regulations that will make food available or cheaper. And
so basically, just getting the support that's needed to help everyone out, and everyone playing their part too, of course. I want to thank you all for coming out this evening.
Thank you.
And
Thank you.
for talking about an issue that needs to be talked about and more people need to take seriously. Thank you so much.
Thank you.
That was For the Record this evening. We hope you enjoyed the show, and will join us again next Sunday.